You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, today I take you through something where it's a continuation of the concept we started building last week. My friends, today we are going to talk about winging of the scapula. Now, whenever we talk about winging of the scapula, then oftentimes, yes, the muscle, yes, which is involved is of course, serratus anterior muscle. That's the one we described, yes, last week. That if, for instance, the serratus anterior muscle, yes, it becomes weak or it begins to waste. Why? Because of injury to, of course, its nerve supply by way of the long thoracic nerve. Yes, we talked about mastectomy could, lead to such injury. We talked about, yes, lymph node dissection, axillary lymph node dissection, some of those things. Even some activities like javelin and all that could cause some kind of stretch to this long thoracic nerve, causing, the paralysis, so to speak, to, of course, the serratus anterior muscle, the boxer's muscle. Now, please understand something, that whenever we talk about winging of the scapula, we have two kinds. It could be a medial winging of the scapula, and then it could also be a lateral winging of the scapula. Now, last week, the description I gave you regarding the injury to, of course, the long thoracic nerve manifesting, okay, in, of course, wasting of, the serratus anterior muscle, where I told you that if clinically you ask the patient to push against, a stationary object like a wall, then what will happen is that, yes, you see prominence of the medial border of the scapula, including the inferior angle. That one is actually called medial winging of the scapula. So whenever we talk about winging of the scapula, then you need to understand which of them we are talking about. Are we talking about the medial winging of the scapula, or we are talking about lateral winging of the scapula? Just to tell you something so that we get into the lateral winging of the scapula, whenever we talk about medial winging of the scapula, then the muscle involved is, of course, serratus anterior muscle. And so for this reason, what will happen is that for the medial winging of the scapula is, yes, very, evident, even, at rest, without having told the patient to push against the stationary wall. Okay, it will be evident. But of course, the prominence, okay, will be more pronounced, okay, when you ask a patient to push against a stationary wall. And remember that the nerve which is injured, of course, is the long thoracic nerve. That's the first thing which I want you to understand. And whenever that happens, you see that it's like the bed. That's what we call it winging. Wing of a bed, trying to pull out. So you see that the medial border of the scapula, together with the inferior angle, will move, away from, of course, this, posterior aspect of the thoracic cage. That is what you'll be seeing. And then also, yes, so that is something we call translation of the medial angle of course, of the medial border of the scapula together with, of course, the inferior angle of the scapula. That is what we'll be seeing. Now, my friends, as far as the lateral winging of the scapula is concerned, it's quite minimal, so that even at rest, you don't see it prominently. Now, the only time we are going to see it very prominent, yes, will be two situations, which I'm going to explain. And so for this reason, whenever we talk about lateral winging of the scapula, usually we're talking about lateral displacement or lateral translation of the scapula together with, of course, inferior angle. And my friends, one thing I want you to understand is that whenever we talk about lateral winging of the scapula, the main muscle that is involved is, of course, the trapezius muscle. And my friend, the trapezius muscle is supplied by, of course, the spinal accessory nerve. So for instance, if the spinal accessory nerve gets injured, of course, the posterior triangle of the neck, then you will be seeing this lateral winging of the scapula. For this reason, you will see wasting of what we call the trapezius, wasting of the trapezius. You will see that the muscle, will become so thin. My friends, not only that, this, trapezius is very important as far as shrugging of the shoulder is concerned. And so you'll not be able to shrug the shoulders. That's another thing that you'll be seeing. And my friends, because you cannot shrug the shoulder, keep this, shoulder at this horizontal plane, there's going to be that kind of, depression of the shoulder. Not only wasting of the, trapezius, but also depression of this shoulder. And my friends, there will be lateral translation of what we call the lateral border of the scapula, or the scapula itself, together with, of course, the inferior, angle. As I said, at rest, it will be minimal, it will be less prominent. But the time that you are going to see it manifesting clearly for you to see is for you to ask the patient to do some kind of physical, activity. And which physical activity are you going to ask the patient to do? My friends, what we are going to ask the patient to do is for the patient to do something we call abduction. So when you ask the patient to do an abduction, you will see that the prominence of the lateral border of the scapula together with the inferior angle will be shifted, okay, toward the left side, okay, toward, lateral aspect, and it will be very prominent over there. And that is when you can confidently say that, of course, we are looking at, lateral winging of the scapula, and of course, injury mainly to, of course, what we call the, spinal accessory nerve, and precisely the muscle that is involved is, of course, the trapezius muscle. Now, whenever I talk about lateral winging of the scapula, there's one muscle which is also a culprit. Yes, that one too, at rest you won't see it, okay? But this time around, that muscle, they are the rhomboideus muscles. Now, the rhomboideus muscles, they are overshadowed, yes, by what we call this trapezius muscle. So they are covered by it. Remember that as far as the medial border of the scapula is concerned, it is known for insertion of muscles. Yes, one of such muscles is what we discussed last week, and that's exactly what we've continued this week by way of the serratus anterior muscle. That one attaches to the ventral aspect of the medial border of the scapula. But this time around, the rhomboideus will be attaching to, of course, the medial border, but this time around along the dorsal aspect, yes, by way of at the level of the inferior angle, and of course below the inferior, yes, at the level of inferior, the spine of the scapula. Actually, you'll be seeing the insertion point for what you call the rhomboideus minor muscle, and below it, up to the level of inferior angle, you'll be seeing the insertion point for what you call the rhomboideus major. Remember something, that the rhomboideus, they are responsible, yes, for retraction of the scapulae, bringing the medial borders of the two scapulae, yes, closer to the midline of the body. That is exactly opposite to what happens, okay, by way of the big swing muscle, the action by way of the serratus anterior muscle. That one is for protraction. But of course, we said that rhomboideus will be relevant as far as, adduction of the two scapulae are concerned. That is what we call retraction of the scapulae. Remember that this time around, the nerve supply is by way of the dorsal scapular nerve. And you know that the dorsal scapular nerve also supplies what we call levator scapulae. Okay, so for this reason, whenever there's that kind of, lateral winging of the scapula, then of course the shoulder will also be depressed again. Because the same nerve that supplies the rhomboideus also supplies the levator scapulae. So there will be depression of what we call the shoulder. And my friend, there will be that translation also of the, medial of the what we call lateral border of the scapulae together with, of course, the inferior angle, laterally. So that's what is going to happen. Okay, now this time around, there will not be any wasting of the trapezius. There will be wasting rather of the rhomboideus together with the levator scapulae. But of course, that one will not be so evident. As I said, it is overshadowed by what we call the fibers of what we call the trapezius, and so we'll not be able to see that one clearly. And so then the question is, how do you know that you are looking at this, lateral winging of the scapula, not due to, what we call the trapezius, but this time around due to, wasting of the rhomboideus major and minor muscles. And my friends, what you are going to do is that after asking the patient to do this forward elevation over here, you ask the patient to, of course, extend the shoulder joint. Okay, extend the upper limb at the shoulder joint. So upon extension, you will see the lateral winging of the scapula to be very prominent. That is when you know that you are looking at, lateral winging of the scapula due to injury of what you call the dorsal scapular nerve, and therefore wasting of what you call the, the rhomboideus major and of course minor muscles. My friends, I'm very grateful for your time this evening. Yes, going forward, I bring you a lot more of these, clinical anatomy bits. Have a good night, all of you, and may the good Lord richly bless you. Amen.